Okay, we'll get started in just another moment, trying to give everybody an opportunity to get logged in. Alrighty, let's go ahead and get started. Hopefully everybody has had a chance to get logged in. Welcome. This is our June edition of the ONN webinar. And as always, we'll start with some announcements and reminders. Um, we have our next office hours coming up on June 18th at 11 a.m. I will send out that invite either this afternoon or tomorrow. So please be on the lookout for that. I send it to the main list for ONN. So please keep an eye out for that. We would love to have you join us. We had some great dialogue and discussions at the May one, and we're hoping for the same thing as well in the next couple weeks. Quick reminder, the GaPQC website is what we're attempting to be a one-stop shop. So resources, old recordings of webinars, educational information, things of that nature. Please head to that website and to grab all of those things. World Breastfeeding Week is coming up. It's August 1st through the 7th. The theme this year is Closing the Gap, Breastfeeding Support for All. Is anybody on here planning on celebrating or doing anything special on your units or maybe with organizations that you work with? Feel free to chat it in. Thumbs up is good. I know it still kind of feels like the start of summer, but we'll blink and it'll be August. So and if that hasn't been on your radar, hopefully now it is. And maybe you can think of some way to recognize that on your unit in the next couple months. Alrighty. Another reminder, we have an upcoming learning opportunity that actually is related back to the World Breastfeeding topic. The EPIC webinar for June is Closing the Gap, the Physician's Role in Eliminating Racial Disparities in Breastfeeding. It'll be Tuesday, August 27th at 12:30. And you can find previous recordings at the link here. I will include that in the wrap-up email as well to make that easy to find and access. EPIC is run with the Georgia Association of Pediatricians. So feel free to go check out their website. They also have a ton of great information and resources there if you have not found those already. Alrighty, just in case you had forgotten, there is still time, guys. CDC has extended the deadline for the MPINK survey. Our last participation percentages for the state were not optimal. So please, if you are not sure if your facility has done this, please ask your leadership. Hopefully that will prompt them to ask administrators or other individuals in leadership to ensure that your facility has completed this. It is sent out to all the birthing facilities in the state, and there is some really great information that comes out of this survey. It's every 2 years. It helps us from a state perspective do some planning to help encourage and promote infant nutrition, maternal health, and breastfeeding. It also will provide a unique report for your facility that is all about your facility's information, and it is a private report. Those aren't sent to the state. We get aggregated data from the state level. So it really is beneficial for everybody. So please ask around, ensure that your facility has done this. We very much appreciate that. Another reminder, Georgia Train or Train Georgia um, is an excellent resource. I think it's a great resource from a nursing perspective because we have all these wonderful micro lessons that are on there. There's well over 20 of them now. You can see over here, this is what the login page looks like. And then once you get logged in, all you have to do is type in GaPQC and it will pull up all of the previous micro lessons. So it's a great chance to go back and brush up on some fundamentals if you need that, or if you're just curious and want some bite-sized information about specific topics, it's excellent for that as well. If you need help setting up a Train Georgia account, do not fear. Um, the GaPQC website has you covered. So if you go to the GaPQC website under the neonatal tab, we have ONN resources toward the bottom. You're going to click on that little button, and then you'll see down here this is the link to the Georgia Train website. And then this over here, this logo, is going to link you to a PDF with step-by-step instructions, including pictures on how to set up a Train Georgia account. So we're trying to make it easy and very user-friendly. Please jump on when you have a moment, create that account. It will give you access to all things in that account. So you could look up all kinds of different topics. We, of course, would love for you to be looking up GaPQC content, but lots of good information in there. Anybody that is in the state, you can sign up for free. There's no charge. You'll put in a few basic information, tidbits of information. You can enter your nursing license and some other things in there as well. The system, from my understanding, does try to once you put in your credentials, it'll help you access relevant information. So don't forget that that's there. Please make use of it. We encourage it, and lots of just good, great, digestible content, much easier to watch in a few moments here and there than our webinars. So thanks for doing that. Apologize. Give me just a second, guys. There we go. Okay. All right. So now to today's topic. Today we're going to discuss PDSA, back to the basics, how to make incremental change through baby steps. And yes, I did include that for a little lame pun. I'm hoping by the end of this, you will, one, realize the importance and significance of using PDSAs in your quality improvement work, and two, recognize that it's something very doable that you can implement tomorrow. We will start with a movie clip from October Sky. This came out in the 1990s. And then we'll chat about it.
Here's my most updated copy of this, Bob,
Okay.
for your use.
All right. All righty. So, what did you notice in the video clip? Feel free to either pop off mute or chat in.
I like Teresa's comment. If at first you don't succeed, try again. Like that's you got to just keep
Exactly.
trying different things.
Yep, exactly. And working together. Yep, love it. Perseverance. Very essential. And pretty much everything in life, right? Right. So, yes, debriefs. Yes, perfect. Thank you. So yeah, there were lots of trials, right? Um, they were predicting what they thought would happen. There was an intentional discussion amongst the group. We're going to do this because we think this is what's going to happen, right? They talked to an expert, right? They kept going back to the gentleman in the building to talk about what had happened and then walk through it together as a group. Oh yeah, excellent point, Deborah. Community involvement. I love it. There were some failures, right? We saw those. And there were some successes. So, in case you hadn't already figured it out, they were doing a PDSA. They were planning, doing, studying, and acting. And then I took the liberty of adding a repeat with intention to this. So if you see a typical graphic for a PDSA, that's not included. But I added it because it's incredibly important. The PDSA was actually created by the Associates in Process Improvement. As a reminder, this is not a one shot, one time. This is an over and over again with purpose and intention. So, fundamentally, PDSAs are integral to the process and quality improvement. They're reiterative, so we do them over and over again with small changes each time. They are small scale, and they can be applicable to any setting. I was thinking the other day that I had basically done a PDSA cycle when my oldest child was very prone to car sickness, right? So, not fun for anybody involved. And it took me several PDSA cycles, but I finally came up with a strategy so that we could take road trips and all enjoy them and survive them without a disaster in our car. PDSAs are not difficult. They're not large scale, and they're not a step to skip in quality improvement. The small scale allows you to notice impacts that may be overlooked if you were implementing several big changes all at once. And since they're small scale, you don't need to have full unit buy-in or complete leadership buy-in. Many of you had mentioned in the survey that I sent out regarding the O&M initiative as a whole, that these were some of the challenges that you were coming across. So if you start with small scale changes, you could potentially have positive impacts without having full buy-in from the unit. So something very crucial to remember. PDSAs regularly, you may not realize it, but nursing interventions are PDSAs, right? You try a nursing intervention, it doesn't work, you try a different nursing intervention. So you're already doing these. You just may not have thought it in that regard or kind of in that application. You want to make sure that you create a plan for what to change next time and then do it. They can have meaningful impact and with small changes, but improved data will not be sustained without meaningful changes. So without making the small integral changes through PDSA cycles, you're not going to have sustained improved data. So data without changes is not sustainable and not going to hold for the long haul. Okay, so plan. The plan step is the who, the what, the where, the when, and then the prediction. So, as far as ONN is concerned, who is usually your patient or your dyad. The what is the action or the specific unique change that you want to implement. The where is usually your unit. The when, that could vary some, right? It could be the first half of a shift, it could be night shift, it could be a week, it could be a couple weeks. And then what's really vital and important is the prediction. You want to make sure that you predict what you think will happen. So without the prediction, you're not going to know how to carry out your next PDSA cycle. More to come on that. And remember, start small. The next step is the do. So you're going to implement what you planned in the previous step, right? And then you want to make sure to write down all the pertinent details. So what challenges you came across, issues that you came across, whether they were anticipated or expected, right? Sometimes we implement small changes knowing and suspecting in our heads that this or that may prevent that. And things that were unexpected. What surprised you about implementing? Remember, this can be brief. This documentation doesn't have to be pages long. This can be a couple bullet notes on a sticky pad or on your little nursing brain sheet, right on the back of that, maybe. Or you could do a couple minute voice memo if that's more of your style. This isn't meant to be a difficult part of the process, but it is important because you're likely not going to remember every little detail, right? Every little surprise or unexpected good or bad thing. The next part is the study. So then when you've got some time, maybe not in that same hour or even maybe in that day, maybe the next shift or the next time that you have a few moments, you're going to study. You're going to go back and look at that, bullet point notes that you made or listen to your voice memo and analyze what we like to call your qualitative and your quantitative data that you wrote down in the do stage. How did it compare to what you had predicted in the plan stage? So in your plan stage, remember, you had a prediction. You thought X, Y, and Z was going to happen. Is that what happened? Why or why not? What did you learn? Because it's important. If we're going to make any kind of improvement in life, we have to step back, reflect, and learn, right? It's the only way we all get better at anything. And then finally, the act stage. So based on your analysis from the study phase, what would you change for next time? Would you adopt any of the changes that you did and make them permanent, a normal part of your day-to-day work? Would you abandon any changes or practices, something that you thought was going to be super easy, and in fact, it was the hardest part of the whole thing? That completely happens, right? How will you share what you learned with others? What does that look like? Does that look like chatting with, your nursing work wife or husband while you're running down to the cafe to grab a coffee? Does that look like jotting a quick note to your unit nurse manager or your um, leadership, right? Hey, I tried this and this worked out great, or this didn't work well at all, to make sure that maybe nobody else tries to do that, right? If you don't have buy-in, maybe you just go to colleagues and chat with them about it, right? Until you can get to a point where you have leadership buy-in. How will you start a new test of change then, right? So you've studied this, you've come up with a new plan, maybe you've shared it with some friends or some leadership, some colleagues, and how are you going to then adjust and create your next PDSA cycle? So, in case anybody wondered, there is published literature about this, which you probably already know. Um, There was a published study a couple years ago. The DOI is at the bottom of the slide if any of you are really curious and would like to pull up the study. This was a Q-based feeding initiative in a level 3 NICU in the Northeast in the US. This was I would say, a little bit bigger scale than a PDSA, truly. But it's always good to remember that at the end of the day, we're doing PDSAs over and over again to create big changes, right? We're trying to improve health, equity, patient experience, or on more of the granular level, breastfeeding habits and the ability to breastfeed, right? We're trying to improve maternal mental health, right? If mom is less stressed about her ability to breastfeed, then it's going to be better for her and her baby, right? So, in this sort of bigger scale initiative, they educated staff on cue-based feeding, and then they trained staff on early hunger signs. They completed an audit prior to the training and then after the training. And when they did this, they realized that through this process and quality improvement efforts, they reduced the time to achieve oral feedings by nearly 7 days in a NICU, which is mind-boggling, right? That's huge. They clearly decreased the length of stay, right? That's one of those big indicators in a baby getting to go home sooner, right? Like the family can now resume normalcy, right? They can all go home and they can really become like a family unit at home, right? They increased parental involvement, which is always a win, right? And they save the organization money, which, yes, we all care about that, right? That is an important factor. But at the end of the day, they were able to move major milestones for these families on their unit. So do not be discouraged. Your quality improvement does lead to really good things. So what does a PDSA look like in real life, right? So I'm going to walk you through one, and a big shout out to Amanda at Northside for sharing this with me. I reached out to several people and asked for some examples, and she sent me several. So I took one of those with her permission. So thank you to her. Her goal with this PDSA, and we could kind of think of the term AIM, right? It's something we talk about in the quality improvement world. AIMs generally are a bigger scale goal, but they're a goal nonetheless. So her goal was to improve infant well-being, right? It's broad, general. When we're talking about aims, we tend to talk in more detail, but it's always good to have an overall goal, even if you don't have a specific aim yet for your unit. So her plan, her who was 5 dyads. The what was to perform all mother and baby care in the patient's room. The where was on the mother baby unit. The when was over a 2-week span, and she was working night shift. And her prediction, and I quoted this here, she said, I expect that this change in practice will nurture a calmer, less interrupted nursing sleep pattern in breastfeeding families, leading to better feedings for baby and more sleep for mother. And boy, don't we all wish moms could get a little more sleep, right? And just an overall better experience for everybody involved, right? So, her do. So she carried this out on 5 dyads. She attempted 6, and I'll circle back to this in a moment. She made sure to include first-time mothers and mothers with other children. She included both native English speakers and those who did not speak English. She included 3 babies with a screening due during the night shift. So if you think back here, she's in her head anticipating some of the hurdles or barriers that might come up, right? So a screening that's timed during night shift is obviously something required, right? It's part of nursing practices, hospital protocols, standards that we have to uphold, right? But the timing is more challenging, of course, right? It's in the middle of the night when everybody ideally wants to be sleeping. And maybe baby wants to be eating, right? So she's already kind of anticipating some of the potential hurdles that might come up. And that also goes back to the non-English speaking families, right? That's something that can be a barrier in care and requires an interpreter, right? Which is sort of a whole other level of working with your family and your dyad. She included exclusively breastfeeding dyads and dyads that were breastfeeding, but also supplementing with formula. So she's diversifying her dyads, right? They all kind of have different goals. And then 2 of the babies were receiving phototherapy. So there again, another one of those potential barriers to her overall intended change in practice, right? She made sure to document the process, and what surprised or things that were unexpected. One of the dyads she attempted the change with had a mother that requested the infant have the blood drawn outside of the room. She didn't expect that. She anticipated that nobody would really have a problem. She did um, tell the families prior to, hey, I'm planning to do all of my care in the room. And this mom expressed concern about seeing her baby in pain. So she decided not to implement it with that family. So completely understandable, right? Um, she just course corrected right then and there and just didn't include them in her PDSA. Okay, so the study. She made sure to document everything, and she found lots of really interesting information. She saw that there were more peaceful feedings, and the physical door to the room was not opened as frequently, which we all know if we've ever been in a hospital for a night shift. That is the worst thing ever, right? You start to doze off and the door opens again. And you just never get remotely decent sleep when you're in the hospital. So just by the sheer act of implementing this change, she was opening the door less, which undoubtedly made things more peaceful in the room, right? She noticed that those exclusively breastfed received no formula supplementation during the shift. Yay, right? That's one of our goals with our ONN initiative, right? She noticed notable improvement in NIP scores for those receiving heel sticks and being comforted by the mom, which is really awesome, right? The babies were calmer sooner. They felt better sooner, right? The non-English speaking patients actually really liked the involvement, even though it included extra interpretation. The patients could see what was happening, and that helped build rapport between her as the nurse and the families. The parents expressed gratitude. She even put some quoted comments from parents in her notes, which for anybody that's had a really rough nursing shift, it's always nice outside of PDSAs to be able to go back and see some of that feedback from families, right? If it's been a really bad shift, sometimes you just need that little pick me up that the work you're doing is important and profound. Um, she didn't observe any anxiety from mothers during the painful procedures for infants, which I thought was remarkable because she had explained at the start of the shift what was going to happen, right? So moms were prepared and educated, and they knew that there was going to be the quick heel stick. And that anticipatory education helped them handle the whole situation better. And she noted that she was surprised that she didn't find the whole thing to be a hassle. One of the things she expected going into it, as a nurse was that it was going to create a lot more work for her from the nursing end, right? She was trying to intentionally cluster the care and do it all there in the room. So she had to plan ahead. She had to make sure she had all the right supplies. Um, Knew everything that she wanted to do while she was in the room, had the interpreter if it was needed, all of those things. So she expected it to feel like more work, right? But in fact, it didn't, and it improved her efficiency, which is even better, right? Maybe she'll actually get to have a lunch today, right? So, her act phase, she wanted to continue the practice. She did note that an additional scale or two would improve the process and the flow. That was one of the hurdles that she had noted, was that she was waiting on one of the other nurses to finish up with the infant scale to bring it into the room with her. So it might be helpful if everybody wanted to do this, right? If they have full unit buy-in and everyone wanted to implement this change, a couple extra scales might be handy if it were in the budget, right? She said for the next time, because remember, an important part of the ACT stage is to plan for the next time, right? What are we going to do differently next time? She wanted to try the painful infant testing while the infant was skin to skin. And of course, remember, she's going to predict what's going to happen with that new change. Her prediction was that she would see even more improvement in the pain scales. So makes sense based on our evidence, right? So good prediction and a really good next change to make in her next PDSA cycle. So thank you to her for doing this. I thought it was an excellent example. Um, one thing you might want to consider, she put a lot of variables into this PDSA, right? She included diverse dyads on a lot of different levels. And she was intentionally anticipating the things that might come up, which was excellent. But maybe you might want to start a little smaller, especially if you're new to the PSA cycle process. You might benefit from starting with something even smaller, right? So stick to only 3 dyads over 2 weeks, and maybe only the ones that want to exclusively breastfeed, right? And ones that you may not need interpretation services for if they're harder to come by and you're working night shift, right? So you can anticipate some of those same hurdles, and if you want to keep it simpler, you certainly can. Keep it simpler, run your PDSA cycle, document, see how it goes, and then plan for the next change, right? Okay, so what PDSAs have you done? Who would like to chime in and share? Anybody? Feel free to chat or you can come off mute. Either way is fine. I know I put y'all on the spot. It's okay if you don't have anything off the top of your head.
Hi, this is Teresa McCullum
Yeah.
at Wellstar MCG. How are you all? So I have to admit that your presentation makes the PDSA sound so easy, but I just
Good.
remember us feeling like they're intense. They involve data, and so it was like, oh my gosh, and there's a worksheet. But we've done several. But one I was going to just mention was to in kind of standardize the golden hour back in labor and delivery. Lots of data that's where we should be, and it's not even new data. And so we kind of bit off more than we could chew in the beginning. So I like the idea that you're emphasizing that you should take something small and do it on a small scale. So needless to say, we did several cycles that we bit off more than we could chew, and then we finally were able to hone it down so that we could run several cycles. And so we were able to make a change that in general, most babies and babies that were eligible were able to have the golden hour in L&D, regardless of their feeding choice. And it became easy for the staff to be able to implement that, except then the staff changed. And so we are now about to embark upon, another cycle of PDSAs to try to, find, it's already, it's in the atmosphere, so it won't be brand new, but we're finding that it's a good idea if we revisit and, try to bring things for the new folks, bring them back around.
No, that's awesome. Thank you for sharing. Yeah, the PDSA is intended to be straightforward and simple, right? Because it is so difficult to change culture, right? Every unit has a different culture, every entity has a different culture. And if you are trying to bring about meaningful, sustained change, right? The golden hour, an excellent example. It is difficult to move the needle with things like unit culture and system culture. So it is much more doable and achievable if you start small, right? Start with staff that are interested in following evidence-based practice, right? You mentioned there's a ton of good literature saying how great this is, right? So start with those that have buy-in, right? Don't start with the person that is absolutely totally resistant to change, right? I will say I have heard recently of an argument of starting with that person, but I think realistically it's much easier to start with people that are interested and then implement your small PDSAs over time, see how it grows and improves, and then maintaining is almost a different discussion, right? But yeah, maintaining can take a lot of effort in and of itself, but you could potentially do some small PDSAs with your new staff, right? It gives them an opportunity to participate in quality improvement efforts, right? So you're teaching them from the get-go that this is a part of our culture, that we want to improve patient care and we care about following evidence-based practice, right? So you're developing and improving that culture from the moment they're onboarded, right? Which will help develop and sustain a culture long term. And it will get them involved. Hopefully, they're eager and excited to be there. So you can kind of capitalize on that. Um, and hopefully they'll stay around, right? If they feel engaged in the unit and feel like they're a part of the unit, that certainly there's evidence to show that staff anywhere, if they feel like they're a meaningful part of the team, they're more likely to hang around, right? And so your retention might improve too, as sort of a side benefit, right? Kind of like that side benefit of, that I mentioned of that facility having decreased costs, right? It's something we absolutely all care about, right? Because at the end of the day, you got to keep the lights on, you got to keep staff paid, right? Um, you want to keep nurses, right? You want to retain nurses, right? But we're going in it trying to improve patient care and well-being, but it's not a bad thing to have other side benefits like retaining staff. Um, so yeah, absolutely. And yeah, start small and slowly build, right? It doesn't need to be a massive change all at once. People have a harder time with massive changes all at once, right? If you're trying to, and I kind of hate this analogy, but it's one that I feel like most people can understand or relate to. If you're trying to improve your overall health by eating healthier and exercising more, you're not going to be able to go from no exercise to running a 5K and, eating out 5 times a day
Right.
and eating healthy the next day, right? Not realistic. So, I'm sorry. Did somebody else want to pipe in? Maybe not. So anyways, yes, small baby steps, small PDSAs to start to grow to a gradual, bigger change implementation. So, did anybody else have any PDSAs that wanted to share? It doesn't necessarily have to be directly related to your units. If you got something other than diet and exercise, that's always welcome, right? Or any questions? Anything about it that seems confusing or otherwise unclear? All right. Well, thanks for those who contributed. I really appreciate it. I always like having good, tangible examples to relate and help synthesize the information. So quick reminder, it's not rocket science, it's improvement science. And never fear, I have the attendance QR code this time, guys. I'm sorry about last month. So if you'd like to record your attendance, go ahead and scan that QR code. I can also send out the attendance record in the email as well if you'd rather just do it via email. So, all right. Any final questions for the day? And if you have a burning question and don't want to say it here, that is a-okay. You hopefully all have my email, but my email will be in the wrap-up email. So please always feel free to reach out. I'm happy to answer any and all questions. And of course, if I don't know it, I will find a friend that does know it, or I will hit up some research. So please reach out. We are here to support you in your quality improvement efforts. And I hope everybody has a wonderful rest of your Tuesday and a good week ahead. It's pretty lovely weather. There's like no humidity today. So what more can we ask for in the state of Georgia in June, right? All righty. Thanks, everybody. And y'all have a good rest of the day and week.
Thanks, Laura.
You're welcome.